And it's time now for the Business of Health, brought to you by Hendricks Regional Health. Well, Indiana University Health says it is the first in the state to bring a cutting-edge treatment called CAR T-cell therapy to patients with certain cancers. Business of Health reporter Kylie Valletta has details. Kylie.
Thank you, Gary. Doctors have given only 2 patients in Indiana CAR T-cell therapy so far, but that number is expected to grow. The therapy is remarkable because it's only a single treatment and patients are showing great success. The treatment targets cancers of the blood system, including acute lymphoblastic leukemia and a specific type of non-Hodgkin's lymphoma. IU School of Medicine Professor of Oncology, Dr. Sharif Farag, joins me now to tell us more about it. Thank you for being here.
Thank you.
First of all, what is CAR T-cell therapy?
So CAR T-cell therapy is really a form of immune therapy for cancer. And it basically involves taking immune cells from the donor, engineering them in a way so that they specifically target the cancer cells and are activated when they meet the cancer cells. So it's really a way of specifically getting the immune system to kill the cancer cells, because normally the cancer sort of turns off the immune system in a way that these cells don't normally or wouldn't otherwise recognize the cancer cells.
And it is considered a cure for certain types of leukemia, improved remission rates in certain lymphomas. What's remarkable is it's a single procedure. Tell us what that treatment process is like.
Yes, so the procedure really involves first collecting the immune cells, or these T cells, from the patient with cancer. These cells are then sent to be manufactured. And the manufacturing process takes about 2 to 3 weeks, and then they're brought back. The patient receives treatment for several days with chemotherapy, and then the cells are infused like a blood transfusion, and so it is a one-off therapy for most patients.
And the results are exciting, but there are some intense side effects.
Yes, the results are very, very good, actually, because patients treated so far have been very resistant to other therapies. The side effects can be severe, but a vast majority of cases are manageable. The kind of side effects, one particular form of toxicity we call cytokine release syndrome, and this is, patients can develop high fevers, drop their blood pressures, can have difficulty breathing, sometimes they can get organ failure, such as kidney failure. The other toxicity is called neurotoxicity, which is really toxicity that involves the central nervous system. So patients can become confused. They may have difficulty speaking. They can actually, in severe cases, actually become almost unconscious. But in the vast majority of cases, these are reversible.
Yes, you've mentioned the patients have done well, and we have just a little bit of time left, but is this showing promise for other cancers as well?
Yes, I think the next cancer that is likely to where CAR T cells might be approved for is actually multiple myeloma, which is another form of blood cancer. But really, there's a lot of research worldwide looking at how to broaden this therapy to many other different forms of blood cancers and potentially even solid tumors.
That's great. And the first pediatric patients expected to be treated this fall at Riley Hospital for Children. Dr. Farag, thank you for being here today.
Thank you. My pleasure.